The benefit of recognizing a migraine attack early is that you're able to take an acute treatment early, and you'll have better results treating the migraine the earlier you take medication for it. There's a wide array of physical symptoms that can indicate that your migraine is coming. You may feel very fatigued, quite common with migraine. You may feel cognitively foggy or out of it. Some migraines actually make people very dizzy and imbalanced when they start. Some people have the auras, which are scary if you've never had one before, but once you come to recognize it, it can be a good indication that your migraine's about to come.
About a third of people who get migraines experience something called aura. This can happen a few minutes to an hour before the actual migraine headache. People who have aura may experience visual disturbances like flashing lights or blind spots, or they may have a tingly sensation somewhere in their body. But most people don't experience an aura at all. This is where keeping a headache diary can be helpful. This technique is useful in identifying the triggers that may cause a migraine.
Sometimes you can have very well-defined recognized triggers, like for women, the menstrual cycle can be a big trigger, and there are menstrual migraine-specific treatments for that reason. You may recognize certain environmental triggers, like weather changes are often a very frequent trigger. You may recognize sleep deprivation as a trigger. For some patients, alcohol can be a big trigger, lack of caffeine, travel. Minimizing these triggers can be important, but sometimes knowing that you're going to be in a situation that's going to provoke a headache can give you a heads up that maybe it's time to do something or take something to turn that headache off as soon as it starts. When you first recognize signs of a migraine, I would tell you to take your acute medication as soon as you feel it coming on. Depending on the situation, if you can maybe find your way to sitting in a dark room, for some people if you're dehydrated, drink some water. If your migraines tend to be provoked by hypoglycemia or not eating and you've gone a long period of time without eating, I would say, have a snack. A lot of people actually find carbonated beverages with sugar and caffeine to be helpful sometimes to turn off migraines, because the sugar can help with slightly low blood sugar. The caffeine can be vasoconstrictive, so some people find those to be helpful too for when they start to recognize signs of a migraine.
Knowing the why and how of a migraine can help better determine when one will happen. And the better you can forecast your migraine, the less likely migraines will rain out your daily life.